So the Republican effort to repeal the Affordable Care Act has fallen short, thank goodness, because millions of people would have lost health care if they had succeeded. But we now are in the phase of trying to find bipartisan solutions to advance health care. Two things are going on. There is a bipartisan compromise in the Senate. I'm on the Health Committee. 25 senators, 12 Dems, 12 Republicans, 1 independent. And we've introduced this compromise, and we have enough votes to get it passed on the Senate floor. We're trying to convince the Republican leader, Mitch McConnell, to give us a floor vote. And so we're gathering like outside stakeholder groups, the Hospital Association, American Cancer Society, are all coming in to support us. So that would help stabilize the market for a couple of years, hold premiums lower, keep insurance companies from exiting the market. But then we still have to find big picture improvements going forward. I've introduced a bill that I call Medicare X with another Senate colleague, Michael Bennett of Colorado, and this would basically direct the organization that runs Medicare to develop an insurance policy that they would sell, so that any individual, you don't have to be age qualified, any individual could buy a Medicare policy that would contain the essential Obamacare benefits, but that would be priced reasonably, because Medicare doesn't have to cover a profit margin, doesn't have to pay taxes, doesn't have to pay fancy salaries to corporate execs. So we think that offering this new public option to everybody is going to be just exactly the right thing to do.
And in your talk at the Democratic breakfast this morning, you mentioned that you felt that Virginia was missing out on some federal medical funds.
We are.
Could you be a little more specific with that?
When the Affordable Care Act passed, taxes were assessed and funds were available for states to expand Medicaid. And there are about 450,000 Virginians who are eligible to receive the expanded Medicaid, and Virginians are already paying the taxes for it, but the state legislature has refused to accept the money. So that's one reason I'm so strong for Ralph Northam to get elected. I think having a doctor as governor, he can make that case to our legislature to help them finally accept these funds like other states have done.
Could you explain why would a legislature not want the additional funds? Is it that they would have to match them? What's the logic?
The match rate is like 90-10. So if they put in 10% of the money, they get 90% of the funds. And most other states, more than 30, have expanded. Many states with Republican governors, with Republican legislatures. But I think our legislature, they don't like President Obama, and because it was one of his initiatives, they're not going to do it. I think a doctor can talk some sense into him, and that's one of the reasons I'm supporting Ralph Northam to be governor.
Thank you very much for joining us.
Yeah, you bet, Kerry. Thank you.